Again, this time for 4 days in their ongoing dispute over pay. From 7 a.m. on Tuesday, the 11th of April, until 7 a.m. on Saturday, the 15th, hospitals will have to cancel or reduce many services. The fresh round of strikes follows talks with the Department of Health, which collapsed almost as soon as they started yesterday. Dr. Vivek Trivedi is co-chair of the BMA's Junior Doctor Committee. Good afternoon, Dr. Trivedi.
Good afternoon, hello.
Good to have you on the programme. Can you tell us what happened at the talks yesterday?
Yeah, of course. So we from the BMA entered the talks in good faith after they were rescheduled at the last moment and after the original date that we'd kind of agreed to was cancelled. But ultimately, we went into the talks hoping we could work towards the end of our dispute. We laid out our ask, which has been in the public domain this whole time, and ultimately, Steve Barclay unfortunately gave us nothing in return. So not only could we work towards a credible offer to put to our members to end this dispute, he gave us no offer. And it's just a bit bizarre that he wants to enter these intensive negotiations when he's not even willing to negotiate.
Is it true that your negotiators said they would not move on their demand for a 35% pay rise?
So junior doctors have had a real terms pay cut of more than 26%. And so that 35% uplift is what we would look for to restore the pay that we've lost. But we appreciate that junior doctors' pay has eroded by this metric. And there's a number of ways that we could work to restore that value, which is ultimately all we want to do. We want to have our pay restored.
But what's your starting point? This is, this is non-negotiable, that level of pay rise.
So that was our starting point, and we were there willing to negotiate, but he was not willing to negotiate.
What? So it was your starting point. You didn't say we're not budging on this 35%.
So like I mentioned, so we're working to restore our pay. As I mentioned to you, and as we mentioned to Steve Barclay and his team, there's a variety of ways that we can get to pay restoration, and we're willing to have those discussions. But he was unable to even give us a counteroffer. So to talk about us not coming into negotiations in good faith, I'd say he's still not even coming to negotiate.
So how long did the talks last?
They lasted for just over an hour, which is promising from our perspective because he initially only allocated us 30 minutes. So not only did he reschedule the time, but to give us a 30-minute window to try and have these discussions, that's not really going to lead to anywhere. Fortunately, we were able to have more time than was initially allocated, but unfortunately, we were unable to get anything from him to be able to put to our members.
If you're talking about restoring pay to that level or some form of recompense, do you genuinely think that the government could do that, given that the other pay deals are being settled at around the 5% mark and there is such a challenge with budgets?
So I guess there's a couple things to unpick there. With regards to the other unions, it's not for me to say what they should do or shouldn't do, but that deal is being put to the membership of those unions to vote on. And ultimately, I support all of my colleagues to restore their pay fully. With regards to is it unreasonable or unrealistic to achieve full pay restoration for junior doctors, well, that cost will actually only amount to around £1 billion or so, which for the government is a drop in the ocean. When we think, what happens if they don't do that? We've seen how patient care has unfortunately deteriorated over the years, with now more than 7 million patients on the waiting list, taking hours, more than 12 hours to see doctors in A&E. We're seeing the effects of not being able to retain our workforce. And ultimately...
just to be clear, are you saying that the cost of £1 billion is to increase junior doctors' pay by 35%?
That's to restore our pay, yes.
So, hold on, because restoring it was 26%, as I understand it.
So, we've had a 26% real terms pay cut. If you have 100, for example, and you lose 25%, you're down to 75. To get back up to 100, you actually need to add a third of 75 because you need to add 25. So just mathematically, that's where that comes from.
That's where it's coming from, and it would cost £1 billion.
Yes, that's the cost to the Treasury. And actually, if you think about cost in itself, so that would restore the pay, which would help restore value and the workforce.
Sorry, forgive me, Dr. Trivedi, because we're up against it time-wise,
Sure.
And so I just wanted to make sure it's clear. Just briefly, is there any chance of having talks or any way that you could see that these strikes won't go ahead in April?
Oh, completely. So our door has been open the whole time, and we maintained that during the last set of strikes, and our door will continue to be open during this set of strikes. And I hope we don't get to that, and we might be able to have discussions before that.
Dr. Vivek Trivedi, thank you very much. Nicola Sturgeon.